couple of months ago, downtown St. Stephen, right in the afternoon, there was an altercation between two men. One was stabbed in the leg, and my wife happened to be coming out of one of the clinics right there and was there shortly after the event, knew the people involved. The gentleman who was stabbed was brought to the hospital, and for whatever reason, he was not able to be served by the emergency room there adequately. This word keeps coming up in my descriptions in my videos. Inadequate emergency room care at the Charlotte County Hospital in St. Stephen. Again, 25,000 residents in Charlotte County, New York County, the riding of Saint Croix. He had to go to St. John, an hour away. Now, I bring this up because part of adequate healthcare, primary healthcare, is access. And I would argue that having to drive an hour for a wound like that is not adequate primary care, and it does not provide the access that people need. And of course, as we all know, if you live in Charlotte County and the riding of Saint Croix, in the summer, our population swells much higher because of tourism. That's what makes it one of the wonderful places to live, but also we need enough care for everybody. Today, I want to continue off on these dispatches from the Airbnb. I'm not sure what you do on your vacation, but I wake up and do an hour of research every morning on the pertinent topic right now, which is number 3 on the 5 priorities that I will work on in terms of the solutions we need for Saint Croix, which is primary healthcare. So really quick today, I want to talk about definitions. Yesterday, I talked about the Canada Health Act, which establishes the standard of care in this country, which makes a province eligible for Canadian transfer payments from the federal government. Now, of course, the province needs to set its own budget. And so in the few minutes that I have here, I want to bring up on the screen a definition, because it's important when we're talking about any topic to understand what exactly we're talking about. So here, let me read to you what is primary health care in this country. What do we mean when we say primary health care? And as we discussed, the regional health authorities, Vitalite and Horizon, what are they supposed to be doing for New Brunswickers? Well, let me see here. I'll just read for you. If you're just listening, I've got a slide on the screen. What is primary health care? Primary health care is about treating acute and episodic illness. This is from the government website. And so you'll see it does say teething acute and episodic illness, but this is from the government website. That is not my typo. Think of that what you will. I'm sure it means to say treating, preventing people from becoming ill or injured, managing chronic conditions, effective use of health provider expertise, efficiency and coordination, and access. That is one of the major things that we will talk about and we'll see in an upcoming slide. And individuals playing an active role in their own healthcare. That is the first, that's the definition of primary healthcare. Now, let me talk about the 4 elements that are generally agreed upon agreed support for primary healthcare. Okay, and again, put it on a screen here because it's a bit dense, but the 4 key elements are teams. So that is physicians, nurses, nurse practitioners, all of the medical health professionals who bring primary care to bear. Access. Primary health care is about access and ensuring that Canadians have greater access to the right services when and where they are needed. Remember the story I told you off the top. Is rural New Brunswick, St. Stephen, the riding of Saint Croix, any of the communities, villages, municipalities in Saint Croix, do we have the access that we feel is necessary? Information is the third. Primary health care is about sharing information with health providers. That is a massive issue in our province. About patients, doctors not able to communicate between each other in terms of your charts, your medical data, etc. And I've heard about patients who have to repeat the whole same information over and over because there's no centralized information sharing. And then healthy living. Those are the 4 key elements of primary care. And somehow I'm already at 5 minutes in the live for five today. And so, what I want to talk about tomorrow, here's some things coming up over the next few days. I want to talk about the New Brunswick Medical Society's response to the New Brunswick provincial government, our provincial government's budget. And I have releases and statements from them. Then I want to talk about the plans that the government has been rolling out, essentially trying to improve a plan that they rolled out in 2017, which of course was a different government, but neither have been effective, and they are going to try to move things forward with, you'll see, not adequate funding. And then, of course, we'll talk about the traveling nurses situation. You might think, well, does he keep banging on that drum? The reason why I'm doing that is because there is this idea that conservative governments are more fiscally responsible. They really know what to do with your money, as opposed to tax and spend governments, like more progressive governments. And you just need to know all the information inside out. Like I say, I'm on vacation. My beach reading is about the provincial medical system, and that is what I want to bring to you and share with you, because what I'm doing is ultimately wanting to be the most effective MLA that Saint Croix has had. I want to advocate in Fredericton for the things that we need, and a community health center. That's where I'm landing with the number 3 ultimately. A community health center in our riding is precisely what we need. And that means defining things properly, seeing what doesn't work, seeing the history of what has been attempted, and then having a plan that will work, that is in line with the top medical advice, and of course, the budget that we have, which we definitely have in this province.